Gentlemen, if you're over 50 and you've noticed your erections aren't what they used to be, weak urine flow, or you're getting up multiple times every night to pee, what I'm about to tell you is going to shock you. There's one mistake, one single habit that almost every man makes multiple times a day that's quietly destroying both your prostate and your sexual performance. And the connection between these two problems? Nobody's talking about it. I'm Dr. Emma Blake, your trusted men's health advisor, and today we're exposing a silent mistake that's affecting millions of men without them even realizing it. By the end of this video, you'll understand exactly what this mistake is, why it's so damaging, and most importantly, the simple fix you can start using today that could dramatically improve both your urinary health and your performance in the bedroom. So stay with me, because this information could change everything. And hit that subscribe button so you don't miss future videos on sexual health and performance. All right, before I reveal what this mistake actually is, you need to understand why it matters so much. Most men think urinary problems and erectile problems are completely separate issues. You go to the doctor, he tells you your prostate is enlarged, gives you some medication for the bathroom trips, and maybe suggests Viagra for the bedroom. Two separate problems, two separate solutions, right? Wrong. Here's what most doctors won't tell you. Your prostate health and your erectile function are intimately connected. The same inflammation that's causing your weak urine stream is also reducing blood flow to your penis. The same pelvic floor dysfunction making you get up 5 times a night is also making it harder to achieve firm erections. And the habit I'm about to expose is making both problems worse every single day. Let me explain the connection, because once you understand this, the solution becomes obvious. Your prostate sits right at the base of your bladder, surrounding your urethra. It's about the size of a walnut, and as you age, it naturally tends to enlarge. Now, when your prostate becomes chronically inflamed, and I'm going to show you in a minute how you're causing this inflammation without realizing it, it affects the blood vessels and nerves that control erectile function. Chronic prostate inflammation reduces blood flow to your penis. It interferes with the nerve signals that trigger erections, and it creates tension in your pelvic floor muscles that makes it harder to achieve and maintain firmness. So you're not dealing with two separate problems. You're dealing with one underlying issue that's showing up in two different ways. Now here's where it gets interesting. There's a specific habit that most men engage in multiple times every single day. Something you probably did this morning without even thinking about it. That's creating massive inflammation in your prostate. And this inflammation is the root cause of both your urinary symptoms and your erectile problems. Pay close attention to this next part, because I'm about to reveal what this habit actually is. Think about the last time you went to the bathroom to urinate. Really picture it. You're standing there, and maybe the stream isn't as strong as it used to be. Maybe it's taking a while to get started. Maybe you feel like there's still more left even after you think you're done. What do you do? If you're like most men, you push. You strain with your abdominal muscles to try to speed things up, to finish faster, to get that last bit out. Maybe you're in a public restroom and feel rushed. Maybe you're half asleep at 3 a.m. and just want to get back to bed. So you push to make it go faster. And right there, that push, that strain, is the mistake that's destroying your prostate and killing your erections. Let me explain exactly what's happening inside your body when you do this, because understanding the mechanism is critical. When you push or strain with your abdominal muscles during urination, you're creating what doctors call counterpressure. Instead of letting your bladder contract naturally and efficiently to expel urine, you're forcing the entire process. This excessive pressure gets transmitted directly to your prostate. And your prostate, which is likely already somewhat enlarged or inflamed due to age, suffers direct mechanical stress every single time you pee. Imagine giving your prostate a punch several times a day, every single day. That's essentially what's happening. This repetitive stress significantly worsens prostate inflammation. And here's where it gets even worse. This pressure can cause urine reflux, where urine gets pushed back instead of flowing out naturally. This creates a buildup of stagnant fluid inside your bladder that never fully empties. That residual urine becomes a perfect breeding ground for bacteria. This dramatically increases your risk of urinary tract infections, which cause even more prostate inflammation. Can you see the vicious cycle? Pressure leads to inflammation, leads to incomplete emptying, leads to infection, leads to more inflammation, leads to more pressure. It just keeps spinning. And all of this chronic inflammation is simultaneously reducing blood flow to your penis, interfering with erectile nerve function, and creating pelvic floor tension that makes firm erections nearly impossible to achieve. But wait, there's more. Constantly pushing confuses your bladder muscle, the detrusor muscle, that's supposed to contract naturally to expel urine. When you constantly help it by pushing with your abs, this muscle gets lazy. It loses its strength and ability to contract fully on its own. Over time, you develop what's called a hypoactive bladder. And the result? You feel an urgent need to pee much more often, even if you just went half an hour ago, because your bladder never fully empties. This forces you to get up 3, 4, 5 times during the night, destroying your sleep quality. And when you don't sleep well, your testosterone production drops, your energy tanks, your mood suffers, and your overall sexual health deteriorates. This one bad habit isn't just harming your prostate, it's stealing your sleep, your energy, and your sexual performance. Now, before you think you're doomed, here's the good news. The solution exists. It's simple, it's completely natural and free, and you can start using it today. The correct technique is called relaxed urination. And here's what you need to remember. Urinating is an act of deep relaxation, not effort or force. Here's exactly what you do. When you feel the need to pee, go to the bathroom right away. Don't hold it. Once you're there, take your time. There's no rush. Instead of pushing with your abdomen like you've done your whole life, do the complete opposite. Totally relax your abdominal muscles and your pelvic floor. Just allow the urine to come out. Let it flow on its own. Let gravity and your body's natural relaxation do all the work. Focus on your breathing. Breathe deeply and slowly. Relax your shoulders, your chest, your diaphragm, and just let the flow start and finish naturally on its own. Don't force anything. And here's the critical part. If the stream stops before you feel completely done, resist the almost irresistible urge to push. Just wait a few seconds in silence with your bladder completely relaxed. This gives your detrusor muscle a second chance to contract on its own and expel the remaining urine without creating that harmful pressure. This patience, this mindful waiting, is absolutely key to your long-term prostate health and erectile function. Now, let me give you 3 additional techniques that can dramatically amplify these benefits. First, if you're already experiencing symptoms like weak flow or frequent nighttime urination, consider sitting down when you pee. I know this might feel culturally strange, but multiple studies show that sitting is the most efficient position for complete, relaxed urination. It helps relax all your pelvic floor muscles and allows urine to flow completely naturally. This isn't about masculinity. This is about your health, your ability to sleep through the night, and your sexual performance. Second, never rush. Take all the time you need in the bathroom, even if it's an extra minute or 2. Rushing is your enemy. Your prostate needs you to be patient. And third, use the double voiding technique. After you finish peeing in a relaxed way, lean slightly forward and wait another 5 to 10 seconds. This simple lean often allows any residual urine to come out, ensuring complete bladder emptying and significantly reducing how often you need to go to the bathroom. Now, while changing your bathroom habits is absolutely critical, there's another piece to this puzzle that you need to understand. Studies consistently show that men who take their prostate health seriously have more energy and better quality of life well into their later years. Having a healthy prostate isn't something you want to take lightly, especially when it's directly affecting both your urinary function and your sexual performance. That's why, in addition to the relaxed urination technique, I recommend comprehensive nutritional support specifically designed for prostate health. I recommend Prostate-Peak, which is a unique blend of over 20 clinically studied ingredients and nutrients specially formulated to support a healthy prostate. What makes Prostate-Peak different is that it addresses prostate inflammation from multiple angles simultaneously. Inside every capsule, you'll find saw palmetto, which supports prostate health and maintains a healthy urinary tract; pygeum, which helps support urinary comfort and a healthy inflammatory response; cat's claw, which may boost your immune system and support overall health; green tea extract, which is particularly beneficial for prostate health; and raspberry, soursop, and a proprietary blend of other plants and minerals that work synergistically to reduce inflammation, support healthy urinary function, and protect your prostate. The formula is completely natural, non-habit forming, and contains no stimulants. And here's what matters most. When you reduce chronic prostate inflammation, you're not just improving your urinary symptoms, you're also improving blood flow to your penis, reducing pelvic floor tension, and supporting the nerve function that's critical for firm erections. It's all connected, and Prostate-Peak addresses the root cause. You'll find it linked in the description below. Here's what you need to remember. Your prostate health and sexual performance are intimately connected. The same inflammation causing urinary symptoms is affecting your erections. The same bad bathroom habit making you get up 5 times a night is reducing blood flow to your penis. Starting today, practice relaxed urination. Stop pushing. Breathe deeply, relax completely, let the flow happen naturally. Consider sitting down. Use double voiding. And support your prostate with comprehensive nutrition like Prostate-Peak that addresses inflammation from multiple angles. Try this complete approach for 2 weeks consistently. Notice if you're sleeping better, if morning erections are returning, if you're performing better in the bedroom, if your urine flow is stronger. This combination of proper technique and targeted nutritional support could transform both your urinary health and your sexual performance. Thanks for watching. Take care of yourselves and see you in the next one.